Welcome back. A major step toward a return to normalcy. The CDC easing mask-wearing guidelines for fully vaccinated people, allowing them to stop wearing masks inside most places and outside. The new guidance still calls for masks in hospitals and when you're traveling on buses and planes in healthcare settings, but clears the way for removing the need for masks in workplaces, schools, and other venues.
All right, to help us understand the changing rules, we have Dr. Suman Radhakrishna from Dignity Health, California Hospital. Welcome to the Fox 11 News at noon, Doctor. Thanks for being with us.
Thank you for having me.
So talk about the science behind this, because it looks like the CDC essentially is giving the green light for fully vaccinated people to almost operate as normal, before the way things were before the pandemic.
Well, the data is that people who have been fully vaccinated, that means 2 weeks after the 2-dose vaccines and you've taken your second dose, or 4 weeks after the Johnson & Johnson, which is a single-dose vaccine, there is adequate immunity that is built up, which prevents people from getting severe infection, from getting mild infection, as well as asymptomatic infection. So based on these studies and the data that has been collected in healthcare workers who were vaccinated and did not show asymptomatic infections, we are recommending that fully vaccinated individuals should be safe in terms of getting COVID and also transmitting asymptomatic disease to other people. This subgroup of people who were looked into were people who were healthy and going to work and taking good care of themselves. There are a lot of people who are not healthy and may not have mounted the response. So this recommendation of getting rid of the masks has to be taken with a grain of salt. People who are ill, who may not mount responses, like people on chemotherapy, people who have had transplants. Right. These are individuals who should consider keeping the masks on. And when you don't know the crowd of people you're around, you should wear your mask regardless.
Right, and the CDC director did say that exception, that if you are immunocompromised, you should still wear the mask. I'm curious what you make of the fact that we haven't reached herd immunity. We're not necessarily, we still have a long ways to go. So were you surprised by this? Does that concern you at all? Do you agree with this guidance?
It's coming, and essentially what now we need to do is weigh it individually. So if you are going to a movie theater, you don't know who's sitting next to you. You need to wear a mask even if you're fully vaccinated. If you're going to visit your parents, grandparents, and you know they've been vaccinated, you're vaccinated, you're okay to behaving the way you did before COVID happened. So weigh it on a case-by-case basis. You're outside in the park and you're walking or jogging alone, you're probably okay not to wear the mask. But if you are with a group of people sitting on the stands and you don't know who's vaccinated and who's not, better to wear the mask.
Yeah, frankly, we really don't know who is vaccinated and who isn't. So you say if you don't know whether people are vaccinated around you, people could very well just go by this guidance and just not wear masks. We don't know whether or not they're a vaccinated person or not. So it's sort of it's a strange place to be in right now when there really are still a lot of unknowns out there, Doctor.
I agree. So, you know, when in doubt, do more, not less.
Do masks when in doubt. Okay, and then
yes.
That brings up the fact about, proof. Will we have to show, how will we show proof? Will that come to be?
That is a different issue, right. And right. That is still being looked into, yes.
Okay, but I do want a clarification, because I was under the impression that it's 2 weeks after your Moderna or Pfizer, your second dose, and also for the J&J, but you said 4 weeks after the single dose J&J. So that is the guidance.
That is the guidance. 4 weeks after the single-dose vaccine and 2 weeks after the second dose for your 2-dose vaccine.
And really quickly, Doctor, I have one more question very quickly, because I did text a friend of mine and I said, look, here's the new CDC guidance. And they were concerned because they have children or smaller children that are not vaccinated. And they're saying, well, it's still doesn't really apply to us because we're still waiting for our children to get vaccinated. What would you say about the concern for children who are not vaccinated and their families in terms of being able to go out and wear masks?
Now children between 12 and 15 can get vaccinated. There are studies that are ongoing looking at safety and the dose requirements for children younger than age 12, because remember, tiny kids don't need the adult-sized dose. So that data is not available. We do know that little children can also get infected, not as seriously as the adults do, but they can get infected, so that's up in the air. So your friend is right. There isn't enough data, and when in doubt, have a party outdoors, wear a mask, socially distance. Those work out very well. And if you think you're sick, if you feel you are under the weather, don't go out.
Dr. Suman, we appreciate you so much. Thanks for taking time out of obviously your very busy schedule.
Thank you for having me.
Thank you. A lot of information there, Doctor. We appreciate it.